Hi everyone, my name is Eleonora Magri. I'm board certified behavior analyst, and today we're going to talk about knowing the signs, early detection, and early intervention services. Today we're going to cover early detection, developmental milestones and developmental disabilities, family involvement and family engagement, and early intervention services. So why is early detection important? The research shows us that intervention is more effective when it's provided earlier in life. A study of children who were diagnosed with autism by the time they were 5 years old, they were more likely to have experienced developmental concern from as early as 9 months. And by 3 years old, these children were more likely to have motor, communication, as well as sensory problems, and increasingly poor emotional and social skills. So the first 3 years of life are so important. The connection in the baby's brain, those neural circuits are most adaptable. And the neural circuits are the foundation for learning, behavior, overall health, and they become harder to change as time goes on. And so it's really a myth that children with developmental disability will eventually grow out of it and they will catch up on their own. And so recognizing the signs of developmental delays means that intervention can begin sooner, and these children can learn the skills they need that are missing. We can prevent frustration and more severe problems down the road. What are developmental milestones? Developmental milestones are skills that most children can do at a certain age, and not reaching certain milestones can indicate that there is a problem. Developmental milestones cover 4 main domains: the social emotional, which is how children interact and show emotions, so smiling at people, imitating other children; the language and communication domain, which is expressing needs, understanding what is being said, so pointing, following directions; the cognitive domain, which is learning, thinking, problem solving, so exploring things in different way, building a tower with 4 blocks; and the movement physical domain, so how children use their body, so crawling, walking, jumping, eating with a spoon. What I also want to point out is the difference between developmental monitoring versus developmental screening. Developmental monitoring is something that we can do, parents can do, by following the developmental milestone checklist and looking at the skills that the child has already. Developmental screening is a test, an assessment that a health provider conducts, and it's more rigorous and it helps detect if there are real problems to then generate a referral for services. This little visual highlights some of the main milestones at the different ages. And so, for example, milestones at 4 months looks like baby should be babbling and responding to affection. Milestone at 6 months is liking to play with others, responding to his own name. Milestone at 9 months, having a favorite toy, understanding no. Milestone at 1 year, trying to say words that you're saying, waving bye-bye. Milestone at age 2, beginning to run, beginning to sort shapes and colors. And milestone at age 3, knowing his own name and age and climbing and running. And so here is a short example of what does an on-track milestone at age 6 months looks like, and what are some of the warning signs. And so in the social emotional domain, the child should be responding to other people's emotion and seem happy often. And the warning sign is when the child does not laugh or make a squealing sound. In the language and communication domain, we should see beginning to say consonant sound, and a red flag when the child does not make any vowel sounds. In the cognitive domain, we should see beginning to pass things from one end to another, and as a red flag when the child does not try to get things that are in reach. In the movement and physical domain, we should see beginning to sit down without support, and as a warning sign if the child does not roll over in either direction at 6 months. Let's now dive into understanding what is a developmental disability. So developmental disability is a condition that impairs one of these 5 areas of development: the cognitive, the physical, which includes vision and hearing, communication, social, emotional, and adaptive. And a condition impacts day-to-day functioning of the individual and usually lasts through this individual lifetime. Most developmental disabilities begin before birth, but some happen after birth due to injury, infection, or other factors. What is important about knowing the characteristic of the most common developmental disabilities, so those red flags, those risk factors, is that it can help us again with early detection. So now let's look at the intake process. So really now understanding the family ecosystem and detecting early signs. The first step in really establishing a relationship with the family that is based on trust is building rapport. And how do we do that? We build trust through sharing our values, through introducing ourselves to the family, through sharing why are we here. And this can also be demonstrated by our behavior, by engaging in active listening, by looking in the eyes, by nodding and understanding when the people are speaking, with our posture, being genuine, showing that we care. And this enables us to be able to then share with parents, and for having parents listen to us if there is, for example, a concern, and so that we can encourage them to then talk with their doctor, refer them to regional center when that concern is seen. I also want to talk about understanding the family ecosystem, because understanding their social, culture, and economic and ecosystem of the family, and really putting ourselves in understanding their world from their perspective, allow us and give us a lot of information to identify possible barriers that might come in maybe the delivery of services, and how to go around maybe some sensitive topics, and really looks at, is the family accessing the basic needs? And so we're talking about food resources, shelter, safety, emotional and mental health. We also want to, in this process, be mindful of the feelings of the families, and making sure that we're asking the right question, especially if we're talking about developmental milestones and we're asking about skills that the child is not meeting, right? We want to also include questions that mom or dad can answer, yes, my child does exhibit this skill. And this really allows us for this intake process to really connecting the dots between the developmental disability, the developmental milestones, and connecting it all together with the specific family ECOMAP. Family engagement, importance, barriers, and consideration is definitely another topic to keep in mind. Again, when we're talking about ensuring that not only we have a service to refer the family to, but then the service is being utilized, right? And so family engagement means building relationship between families and support networks that can, again, ensure the family well-being. And this is a shared responsibility from family, school, community to ensure that the student, the child is successful. And it's continuing through from birth to all the school age years. And it's really a way of creating a system of strategy and resources to then overcome any family barriers. And so I think we've always encountered some families that are not able to participate in certain programs. And so what are the barriers that parents encounter that are not allowing them to be more engaged with the services they have or their children's education? And so the most significant barriers include the lack of time, the lack of understanding of the materials and the services, and the lack of communication between the service providers, the schools, and the family. And so once we understand what are the possible barriers, then we can have conversations around them and be able to support the family in access the services that they need. And lastly, we're going to talk about early intervention services. What are they and how we can access them? So early intervention services are services and support systems that help children birth to 3 years of age with developmental disability of the family. And they may include speech therapy, physical therapy, and any other types of services based on the needs of the family and of the child. And as we talked about, early intervention is so important in really increasing the child's ability to learn new skills, and then make sure that this child is successful throughout life and throughout their school years. There's a series of different programs that are available in every state and every territory, and these services are typically provided for free or at a reduced cost at all the families and children that meet the criteria established for developmental delay. And so what have we learned today in summary? And so the most important reason, right, for monitoring each child development is to determine that their development is on track. And most children with developmental delays are not identified early enough to benefit from early intervention services. We talked about how early intervention can really make a big difference in a child development and their ability to learn the new skills. And if we monitor the development of each child that is under our care, then we can identify those children who might not meet those developmental milestones and that might need that early intervention. And then lastly, we talked about how building trust in relationship with the families really can increase the family engagement and follow through with their services. Again, thank you so much for watching. My name is Eleonora Magri, board certified behavioral analyst. And next, we're gonna have Dr. Watson talk about IFSP.
Hi, I'm Dr. Eleanor Watson, and I am the CEO of ABC for IEP. In this video, we're going to be talking about the Individual Family Service Plan. Ready? Let's go. Again, welcome to the Individual Family Service Plan. Again, I'm Dr. Eleanor Watson, and today we're going to be exploring what is an Individual Family Service Plan and how you can be the best advocate for your little one. So when it comes to IDEA, which refers to the Individuals with Disability Education Act, there are 4 parts, A, B, C, and D. When it comes to your kids, the 2 portions that you need to be paying attention to is Part B and Part C. Today, we're going to be looking at Part C. Let's dive into IDEA Part C. Birth to age 3 whose development may be cause of concern may be eligible for early intervention services through the California Early Start program. Early Start offers coordinated services and supports so little ones make progress in their development and are prepared for preschool and beyond. The program is really about a family-centered approach, and each child at Early Start has what's called an Individual Family Service Plan, an IFSP. An IFSP describes a set of programs and also services to meet your little one's needs as well as their family. Being an advocate for your little one involves understanding how Early Start works. IFSP has a bunch of resources if you didn't know. So within this presentation, I'm going to be giving you 3 slides full of resources. For example, Starting Out Together, Parents' Rights, an Early Start Guide for Families, Handbook on Developing Individual Family Service Plans, a handbook on assessments and evaluations, reasons and concerns, and of course, California Department of Education. My favorite is My Child Without Limits. My personal favorite. There's also Family Resources Networks, PACER, and of course your local SELPA. So let's go ahead and dive right into the overview of an IFSP. If there are concerns about your little one's development, the Regional Center or the County Office of Education will conduct assessments to understand any developmental delays and determine eligibility for Early Start. By the way, you do not have to wait for somebody else to refer you. You can actually call the Regional Center and ask for an assessment. These services are specifically from birth to 3 years old of age that have disabilities or developmental delays who meet these requirements. So what are the steps in early start process? Well, first of all is the referral and the identification. Second is the assessment and then the eligibility. And then 3 is the initial IFSP meeting, and also to write your family plan. Once consent is given, the lead agency, usually it's a regional center, only has 45 days to complete the assessment and also have the IFSP meeting with you. To be eligible, there needs to be a delay in one of these 5 areas, and there is a medical condition that needs special care. Eligibility is determined by the lead agency, usually the regional center or the SELPA. If it is determined that your child does qualify for an individual family service plan, a meeting is scheduled. If no, then the parents are given a prior written notice, which includes their rights to dispute the eligibility decision. So if your child is eligible, the regional center provides early intervention services unless your child has a low incident disability. Low incidence involves the visual, hearing, and orthopedic impairment. The local county office of education is responsible for those services. So the initial IFSP meeting is held and the initial IFP is written. Well, there's 2 general purposes of this. Number 1 is to set reasonable outcomes for the infant and toddler with a disability, and also to state the services that the early intervention program will provide for the infant or toddler and family. The Individual Family Service Plan, IFSP, is written by the IFSP team at your meeting. The IFSP team must include you and your child's early intervention specialist. Sometimes these are called case managers or service coordinators. The team may include other services provided as needed. So who comes to your meeting? A lot of people. First of all, it's you, or if you're a surrogate parent, or if you're a grandparent. Other family members as requested by you. You can bring an advocate or a person outside of the family as requested by you. Persons directly involved in conducting the evaluation. Persons who will be providing direct service to the child and family. The service coordinator who will be responsible for carrying out the IFSP. So where are these services provided? Well, in the child's natural environment, which means it could be in your home, it could be in a community setting. These are called their natural environments. So what are natural environments? Well, as I was saying, home, public preschool, community preschool, early Head Start, daycare providers, child care centers, park and recreationals, play groups, libraries, other programs for children. It's really important to understand that the IFSP has 2 types of outcomes. There's the child outcome and then the family service outcome. The child outcomes could be participation or even routine or activity-based. Here's an example. Let's say we want to help the child learn through participation in everyday activities or be based on the child's interest. Now, family outcomes are goals that tie to meet the child's needs. For example, teach the family how to help the child learn through everyday activities. There are a bunch of ISP services that can support you and also your child. For example, assistive technology, audiology, family training, health services, occupational therapy, OT, physical therapy, PT, psychological services, sign and cued language, social work, speech and language, vision, and also your case manager. Now, we're going to be talking about transition to preschool. As I was telling you, this program is only for 0 to 3-year-olds. Now, at the age of 3, the IFSP is closed. If a child is eligible for services after 3, the IFSP for Early Start can break into 2 parts. The first part is to develop an IPP as part of the Latterman Act. What that means is that they re-qualify for regional center. And they might also qualify for an IEP under the special education. That's where the districts and the SELPA really hone into their educational programs. Really, a child can have both. These systems can seem really overwhelming, Over time, with information and also support, you will learn what is needed to be your child's best advocate. So then what happens? After your IFSP is closed, what happens next? Well, if they continue qualifying for special education, they can be enrolled in a preschool service program under the district or the county. It also can have an early education program such as Head Start or other early educational programs that are provided within your area. So it's really important to understand, if your child does qualify for special education services, this would be considered under Section B. So let's talk about that. The lead agency, the regional center, must also notify the child's LEA, which means the local education agent. And this can be your school district and also SELPA that oversees the district. That the child will soon reach the age of eligibility, that means from 3 to 21, for Part B of IDEA. These are the things that the district must do. They need to provide you with your procedural safeguards. It's also known as your parents' rights. Decide if an evaluation is eligible for Part B if needed. Sometimes it is. Of course, if they do feel that, yes, they need to evaluate, then they conduct an evaluation, and if the child is eligible, an IEP must be developed. Now, don't panic. Services are not being taken away. Remember, the IFSP program is only eligible from birth to 3 years old. So many families that I've come across are really worried that once they leave that early intervention services, that other services are being taken away, and that's not true. The school district just needs to requalify them for an IEP starting at the age of 3. And as a gift to you, what ABC for IEP is going to give you, along with this presentation, is access to your very own IFSP parent checklist. Thank you so much for watching, and always remember that you are your child's best advocate. I'll see you next time.